Welcome back to Medical Monday. Tonight we are talking about plastic surgery and in particular things that you can do with your face to restore that youthful look that so many of us want. Let's face it, nobody wants to get older, I don't think. Dr. Dan Hatef is here with us tonight. Thank you for being here once again.
Thank you.
We're getting our calls lined up. In the meantime, I want to look at some of your before and afters. I think people always enjoy this, whether it's looking at a magazine or on a website.
Yeah.
So we have a couple of different chin, I guess, procedures you've done.
Yeah.
So what is the official name of this? And tell me what you did with these patients. These are your patients, the befores and afters we're going to look at.
So I'm really not aggressive about showing before and afters. I show people in the office, but I don't have any on my website. And the reason is because Nashville is such an industry town. Patient privacy is so important, and so you got to respect that. So I really, first of all, want to thank all the patients that allow me to use their pictures.
Absolutely. Okay, so let's talk about this lovely lady.
So this patient is a 30-year-old female who was unsatisfied with the appearance of her chin and her neck, and so she saw another plastic surgeon who recommended a chin implant. I love chin implants, they have their place, but this patient has a poorly defined crease right here, and she has a small chin that a chin implant is going to blunt that crease. It's not going to look natural. She also has very delicate features, and chin implants, they look good in people with stronger features, sharp features, not in a person with delicate features. So she thought about it, didn't really want surgery, found her way to me, and I talked to her about using fillers. So in her, I used 2 cc's of Juvederm in her chin, and then in her neck, we used Cabella. So Cabella is a new filler from Allergan that actually, it's a detergent. Literally, detergent.
Really?
Melts fat, it binds to the fat particles, causes them to die, and in my hands, Cabella is great, but I've seen some real disasters with Cabella. I've had to do some very, very difficult neck rejuvenation cases that were from Cabella gone wrong. People
what goes wrong? I mean...
So Cabella was sold to us as doctors as no downtime, kind of like the fillers and the Botox. That's not true. You really, because of the inflammatory effect of the detergent, which is what melts the fat, you have swelling for 3 to 7 days. And so when it swells, if you don't compress it, that expands out the skin. So then you have this patient who has this cavitated fat and lacks skin, and often it doesn't look good, so then they'll go back and they'll go back and they'll do it over and over again. And you do have to do Cabella a couple times, but you can cause some real problems if you don't treat it right. So I put patients in a chin strap compression. I tell them this, you're not really neck liposuction, not a neck lift, but you still have downtime.
You still need to take that into consideration.
Oh, for sure.
And then we were on that video looking at the pictures when you said this patient didn't have the crease right here, which I think once we show that to people, they understand. So that was your concern about the chin implant.
Yeah, and just delicate features in general. You know, having an artistic background helps as a plastic surgeon because you really take into account the whole facial gestalt. You've got to look at every aspect of the face, the age of the patient, what their soft tissues are going to look like after you put in an implant. You know, the body forms a capsular wall of scar around any implant, and that capsule will tend to contract over time. So in the face, that's fine if you use it in the right patient. You can actually use that to your advantage. But in a patient with delicate features, they can look really bizarre.
Let's take a look at the next before and after we have. It's another chin operation, or a chin, I shouldn't say operation, that chin procedure is what you did. Here's another young woman. Yeah,
so again, patient who was told she needed a chin implant, not happy with the idea of having that done, doesn't like her neck. She is actually a patient who I recommended not doing Cabella because I felt like she would need a lot of treatments. The patient before had a little bit of fat in the submental fat compartment of the neck, which I helped describe. This patient has a lot more, and she has fat beyond the submental fat compartment boundaries, which is where you want to inject Cabella. So I recommend that we do in-office liposuction and do some filler to the chin. Again, 2 cc's, Juvederm, liposuction to the neck. Very good patient, cooperated with the neck compression. That's a really bad thing about liposuction in the neck. You have to wear the chin strap for 3 weeks, or else you're not going to get a nice result. And she did, and so she has a really nice result.
It's paying off now. Let's jump to the phones as we always do. We promise to try to get as many calls as we can in. We have Brittany on the line. Hi, Brittany.
Hey, thank you for taking my call.
You're welcome. Go ahead with your question.
I was wanting to know if it's safe to continue Botox during my pregnancy, or if there's other safer procedures that are recommended.
Okay, great question. What do you say?
Brittany, thank you for your question. Botox is probably safe. Fillers are probably safe during pregnancy, but just the possibility of causing problems, I don't do it for patient safety, for both for the mother and the child. It's such a small amount that probably doesn't get into the arteries. I think there's probably no issue with it. I don't do it in my practice. What I do for patients when they're pregnant is I use laser genesis. Laser genesis is a low wavelength, non-invasive laser. It doesn't kill tissue. You form a little bit of collagen each time. If you do it very diligently every month, you're gonna have a nice youthful glow. Those lines will be less. You'll look 2 or 3 years younger. It can also help with the melasma that you see during pregnancy, the pregnancy mask. Another thing that's good for that is IPL. IPL is the same. It doesn't destroy tissue. I don't do ablative lasers during pregnancy. The reason is if you get an infection, you have to take the medicine. The infection could hurt the baby. The medicines that you have to take could hurt the baby. It's best just to avoid all that. Now, after pregnancy, you can do all these things, and oftentimes patients come to me and they say, I like the way I looked during pregnancy. Why is that? Because you're retaining that fluid, so your skin, your fascia, the soft tissues are under that youthful tension, and so they like that.
That's the pregnancy glow,
yeah,
probably,
the pregnancy
right?
glow, that's exactly right. So I will use fillers to regain that appearance.
Huh. Great question, Brittany. Thank you for asking, and we appreciate it. Let's jump to Nancy. Hi, Nancy.
Hi.
Hi. Go ahead with your question.
Thank you. My question for the doctor is this. I have a fairly youthful face for 54, but I do have marionette lines. They're not severe, but they're noticeable, and that's very much an age-detracting thing to my face. So how would the doctor recommend treating those?
Okay, first of all, what are marionette lines?
Nancy, that's a great question. So marionette lines are the lines that come down, and scientifically it's called the labiomandibular crease. It comes from the corner of the mouth down to the jowl, and it's caused by the insertion of the depressor anguli oris muscle. The best way to correct it, facelift. But most patients don't want a facelift, especially listening to Nancy. She still looks youthful at 54. She probably doesn't need a facelift just to fill this in. I do 2 things. I use filler to fill in the crease, and then there's a new filler. It's from Allergan. No disclosures, I don't own any Allergan stock. And it's really good for getting those superficial creases better. That's not enough though. Part of what it is the action of the depressor anguli oris muscle. So I'll inject a little bit of Botox, 2 splashes in each side, and it really helps take care of that.
So it's really a multi-dimensional approach. And it sounds like to a lot of the things that you do, you want to kind of spread it out, spread the love a little bit.
Yeah, a little bit really helps.
So how often is she going to have to do this sort of thing though?
So the velour that I was talking about from Allergan, that should last 2 years, probably in the mouth less.
Because of all the movement?
Yeah, because of all the movement. If you weaken depressor anguli oris, it'll last a little bit longer, but it's not going to last forever. She's going to have to do it every year. It's another good place for laser genesis. If you just really diligently come in once a month for laser genesis, I go to town on those lines. You'll look sunburned for a day, but it will really help.
Wow. Okay. I hope that helps, Nancy. Gives you some options at least. And by the way, we will be putting up Dr. Hatef's number and how to get a hold of him, email, web, whatever you want to do. So get a pen and paper handy. We'll be doing that a little bit later on in the show. Let's talk about this laser a little bit more. How does it work? What do you use it for? What can people expect downtime-wise? So
it's a low wavelength laser. It doesn't destroy tissue. It induces collagen formation. The wavelength of the laser gets into those melanocytes in the dermal cells and causes them to reproduce themselves. So it manipulates your cell's genetics to act like younger cells. It's really good if you do it over and over again. I do it every 2 or 3 weeks on myself, and it really helps keep my skin in shape. My wife feels the same way. And my patients that have the best results with the laser, they're diligent about coming in once a month. A lot of people before award shows, they'll come in for about 2 or 3 sessions right before, and it really just helps to give that youthful glow. It doesn't necessarily fill in the creases, but the creases, their appearance is minimized because the tissues are under more tension, so you're retaining that soft tissue away from the creases. What does it cost? Laser genesis for a series of 4, it's $1,000. Okay. So for 4 months, $1,000 is really not that much when you think about what you spend on food and entertainment. What about, does it hurt? Laser genesis doesn't hurt. It's like a warm wave. it's pretty nice.
Huh.
Yeah. Now, when it starts hurting, that's when you know to move on. But it's really well tolerated. IPL can hurt a little bit. My hands, put numbing cream on. I really make sure I take my time and use the cold handle to make you comfortable. But
what is the IPL?
so
What's
IPL is an intense pulse light. Intense pulse light or broad-based light is not like a laser. Laser is monochromatic, meaning one wavelength. IPL is multiple different wavelengths in one light, and that really helps take care of dyschromia, which is a fancy word for age spots.
Gotcha. Okay, we're going to take another quick break. Carol, I know that you're on the line. As soon as we come back, we will take your call. Stay with us.